Dear professors, dear colleagues, may I present to you my work entitled Clinical and Dermoscopical Alterations of the Nail After the Use of Semi-Permanent Varnish. The nail cosmetic industry is a multi-billion-dollar industry. A significant part involves the application of substances that harden after solvent evaporations, like nail polish, or polymerizations, like semi-permanent polishes. Alterations of the nail system related to these practices are common, emerging, and underreported, making them prone to misdiagnosis even by competent dermatologists. We conducted for 6 months a prospective descriptive study of the clinical and dermoscopical aspects of the nail after using semi-permanent varnish, involving women who had undergone this practice at least once. 72 women have been included. We asked them about the perception of changes in nail quality, and 94% of women reported it. We asked the participants about the degree of alteration in nail quality according to them. It was catastrophic in 22% of cases and light in 22% of them. 84% of the participants used the semi-permanent varnish for more than 2 years, and 56% used it more than 6 times a year. We asked them about the pursuit of the use of the semi-permanent varnish despite the damage, and 72% reported that they still use it. Only 27% actually stopped it. We asked the women about their complaints after the removal of semi-permanent varnish. More than 90% reported having brittle nails, and a little bit more than 80% reported having nail pain in day-to-day activities. For results, we remarked first color abnormalities. Here is a retronychia in 48% of cases. Then leuconychia was observed in 50% of cases. Then xanthonychia was observed in 9% of cases, and only 4% had chloronychia. Then we remarked surface abnormalities. First, we had 95% of patients who had onychoatrophia, surprisingly. Then we had onychoschisia, dominantly with 73% of cases. Then nail fissures, clinically 56%. And thanks to dermoscopy, we could see more. Actually, it was 65% of patients who had nail fissures. Then 30% had striated nails. 36% had bow lines. 10% had temple-like pitting of the nails. Then 53% had onycholysis. Here's a beautiful image of onycholysis. Not so beautiful. Then we had flame-shaped hemorrhages in 9%. And once again, thanks to dermoscopy, we could see more. It was actually 15%. Then we had 2 cases of traumatic avulsion of the nails. One was partial and the other one was total. To understand better why it happens, we have to understand how it works. Actually, it goes to 3 steps. 1, we prepare the nails. Then we apply a paste coat to protect them. Then the color polish layer, 1 or 2 layers. Then we seal it with a top coat. The semi-permanent varnish does not dry in the open air. So it is essential to use the UV or LED lamp for it to dry, at least 3 times after each step. To remove it, it's another story. Unlike the gel polish, which does not dissolve chemically and requires a mechanical removal method by abrasion, semi-permanent polish is soluble in acetone. So we apply acetone, we leave it for 20 minutes, and then we can remove it gently with a spatula to be removed. For the year 2022, a synthesis of the side effects induced by semi-permanent nail polishes identified 3 types according to l'Académie nationale de médecine française. It identified 3 types. First, allergic skin reactions in 70% of cases. Mechanical damage was noticed in 26%, and 3 cases had spinocellular carcinoma of periangular skin. The disparity between our study and this one was remarkable. As described in the results above, more than 90% of our participants had mechanical lesions, and only 3% of them experienced an allergic skin reaction. None of them showed sign of malignant skin lesions. Nail damages may be explained with multiple factors. The first one is the use by salons of a mechanical abrasion-based removal method in the majority of cases because it takes less time than the chemical method. We could explain the erythronychia, the onycholysis, the onychoschisia, the fissures, and so on. Then there are the constituents of nail polish, which is pigmented acrylic polymers that could explain also the change of color to yellow, which is the third picture, and then can explain onycholysis and can explain also the periangual dermatitis. The use of UV lamp may explain the 3 cases of squamous cell carcinoma reported in the literature. Here it's a picture of the patient of 65 years old who used semi-permanent varnish for 15 years, once monthly with a UV lamp. Here is the malignant lesion. The non-respect of the recommended resting period of 3 weeks between uses by some users explain the increased fragility of the nails, their soft appearance, and susceptibility to damage, even from minor trauma. However, 5 candidates reported severe damage from the very first use. This study has objectively documented the significant damage caused by the use of semi-permanent varnish. It has once again underscored the importance of dermoscopy in the daily practice of dermatologists and the additional value it brings. Thank you so much for your attention.